exactly is breast cancer?
Breast cancer is like any other cancer in the body. It's an abnormal growth of a cell that starts due to a problem in the cell growth regulation in that cell, and it grows out of control. And it starts to grow into an invasive process, and it becomes a small mass, and it goes from there.
How does that happen? Like sort of.
Well,
Topically.
different parts of the body, like say lung cancer, we know that smoking, the toxins in the cigarette smoke cause mutations in lung cells, if you will, and we're not sure what exactly happens to those breast cells that causes them to go haywire and start growing out of control. But that's one of the major conundrums and focuses of research, is to determine what exactly is causing the breast cancer to develop.
So it's uncertain why exactly it happens.
It is uncertain, and that's one of the reasons why we need to screen every woman who's 40 years and above once a year with a mammogram, because we can't pick out that subset of who's going to get it and who's not based on some cause. Having said that, there are certain women that are at higher risk and maybe need to start screening sooner than age 40, and that would be based on their family history.
What exactly does that screening entail?
For the average woman, that is a process called a mammogram. And a mammogram is actually an x-ray of the breast tissue. And we've come a long way since I started 26 years ago here, and that is, we used to take 2 pictures of each breast and have to develop film. Now we have something called a tomographic mammogram, and that's essentially, for lack of a better descriptor, it's almost like a CT scan of your breast. It's multiple slices through the breast that enables us to look on a microscopic level, almost a microscopic level, at the breast tissue and look for some very early signs of breast cancer. And if we find those signs, we obviously contact that woman, have her come on back into the breast care center here, where we do a further evaluation, which may or may not lead to something called a biopsy or a tissue sampling procedure.
Can people detect breast cancer on their own, or is it something you need mammogram?
Well, they can, in the sense that many women feel a lump in the breast or a thickening or some change, and that will often generate a phone call to us and a visit to the breast center. Now, the vast majority of those lumps that a woman feels, they're not breast cancer. There are many other things that appear in the breast that can be felt, which are not breast cancer, which is why it's important to get everything checked out by somebody who actually knows what it is they're feeling and can do an accurate assessment for them.
What's your advice to patients going through that process to maintain, strength, a sort of happiness?
Well, breast cancer diagnosis and therapy, obviously it's a shock to the system, and people are very upset and very concerned about not only themselves but their family moving forward. And breast cancer therapy has also come a long way in the last 25 years. We have a team of physicians here at UT that, once the patient is diagnosed, that whole case is reviewed at a conference every Wednesday morning, and we, a group of anywhere from 20 to 25 physicians, hear about the whole case, and we formulate a treatment plan. So before anything is done to the patient, multiple doctors have been involved and have rendered the best option for that patient moving forward to treat that cancer. Now, the cancer process, treatment takes months, if not sometimes almost a year, and that is very much dependent on how big that tumor is, how far it's spread, and if we need to do things before or after surgery, because surgery is the mainstay of breast cancer therapy, but that surgery can vary a lot, from just removing the tumor itself and leaving the rest of the breast alone, to some women opting for having both breasts removed and reconstructed. And again, a lot of that has to do with how early in the process did we detect that cancer. If we catch it with screening mammography, those women invariably do very well, and their survival rate is well in the mid 90+% if we have a screening detected cancer. And that's why it's so important for women to come every 12 months and get that snapshot of the breast. It can save their lives, literally.
You've sort of alluded to this throughout the interview, but how has breast cancer treatment, how do you see it evolving over the next few years, decade, 20+ years?
Well, I would like to say I'm able to see the future, but I do think that there's a trend now towards less is more as far as therapy. We're dialing back some of the things we used to do routinely to where we're not being, say, as destructive or invasive with our surgical procedures. Things are being more tailored to where we're able to, instead of looking at all the lymph nodes in the armpit, we're now able to look at just one. And that's a sentinel node biopsy, so that's been an advancement. Will we get to the point where we don't have to look at any lymph nodes? Who knows, but that could happen. There's also things like cryotherapy, where they're looking at freezing tumors moving forward. We have RF ablation of tumors. And I think the biggest advances we've made really in dealing with breast cancer in the last 20 years has been the ability to detect them with the different studies we have, which includes MRI of the breast, and then there's contrast enhanced mammography, which we don't offer here, where the opinion MRI offers us a better chance to look at the breast tissue in the armpits. But and the other thing I wanted to mention with advancements would be the sentinel lymph node biopsy. We used to take all the lymph nodes out when we were treating a breast cancer with surgery. That resulted in a lot of women having arm swelling for the rest of their lives. Now we don't do that. We take out only one lymph node in the vast majority of women, and that does not result in damage to the lymphatic system, and we avoid a lot of those problems that we would call comorbidities, where you ended up with the arm swelling the rest of your life. We just don't have to deal with that anymore, and that's a big deal for those women.